Did you know that every minute a lot of people dies from malaria? Malaria is one of the most deadliest yet preventable diseases in the world. Let's learn what malaria is, its causes, and the most important to learn is how can we prevent it. Before that, I'm Hafiz Muhammad, registered community health practitioner. Malaria is an infectious disease, sometimes called life-threatening disease, caused by a parasite called Plasmodium. These parasites are transmitted to humans through the bite of an infected female anopheles mosquito. And this class of parasites are classified into different species. You have Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale, and Plasmodium knowles. Although Plasmodium falciparum is the dominant species responsible for over 95% of cases of clinical malaria and is the most prevalent and deadliest malaria parasite in the African continent. Symptoms don't appear immediately. The incubation period depends on the parasite, either Plasmodium falciparum. This ranges between 7 to 14 days, or Plasmodium vivax and Plasmodium ovale. The incubation period ranges from 10 to 30 days, sometimes months or even years later due to dominant liver stages. Plasmodium malariae. The incubation period ranges from 18 to 40 days. Symptoms of malaria include fever, chills, sweating, headache, nausea and vomiting, and loss of appetite. If left untreated, it can become life-threatening disease. There are two types of malaria or two categories of malaria: complicated or severe malaria and uncomplicated malaria. Complicated or severe malaria is when the infection leads to organ failure, severe anemia, breathing difficulty, or even coma. This often caused at Plasmodium falciparum. An uncomplicated malaria is the early stage. You may feel fever and illness without severe organ damage. Malaria is diagnosed by looking for parasite in the blood, usually under microscope, or rapid diagnostic tests are also used, especially in the rural areas. The good news is malaria is preventable and treatable, but if left untreated, it can lead to severe illness or even death. First line or primary treatment of malaria is antihistamine-based combination therapy, which is ACT. In severe cases, IV artesunate is given 60 mg or 120, depending on the age, followed by oral ACT. Prevention is better than cure. Protect yourself and your family by practicing the following habits: sleeping under insecticide-treated net, spraying indoors, clearing stagnant water to stop mosquito breeding, clearing all grasses around the environment, general environmental sanitation, while drivers receive chemoprophylaxis, taking preventive medicine before visiting malaria endemic areas. Malaria is preventable, treatable, and curable, but only if we act early. Together we can end malaria. Share this video to the world. Thank you.